go.
Hi Bob, my name is Destiny. I'm just going to be assessing your chest tube today. I provided privacy when I came in. Can you please state your name and date of birth for me? Alright, and it matches my chart. Do you have any allergies? He tells me nope, no allergies. Alright, so I would make sure I have my hemostat with me as well as sterile normal saline and a sterile dressing just in case. So now I'm just going to do his vitals, get all of his vitals right now, and then I would want to listen to the lungs. Alrighty, I would want to listen posteriorly as well, and I would want to be aware of any cyanosis and monitor for some pursed lip breathing. Also, if he is having abdominal breathing, we would not want that. We want abdominal breathing if it is 2 years, if a child is 2 years old or younger. Alright, so now I'm just going to assess the dressing. How are you doing with activity, Bob? Does it hurt? Are you getting around okay? Are you able to manage with the chest tube? He tells me he's doing okay, other than it being uncomfortable, obviously. Alright, so now I'm just assessing the dressing for any drainage, any shadowing, and then I would also want to palpate for any crepitus. And if there was any of those things, I'd obviously want to document and compare them to what the last nurse documented to see what has changed. Alrighty, now I'm just going to examine the tubing, making sure there's no kinks or dependent loops. And then you always want to make sure the drainage system is below the level of the chest tube insertion site. And then now I want to look for any titling. Titling is good, but continuous bubbling could mean that there is an air leak somewhere, either in the tube or in the patient, and you would want to make sure to get that fixed right away. So next I would want to mark on here with a Sharpie where the drainage is, and then I would also want to assess the color and consistency of the drainage, and being sure to document that as well. I would take my gloves off. I would wash my hands. So I would want to document the vitals. I would want to document his lung sounds, and both anteriorly and posteriorly. Document any findings I found with the dressing, whether it was any shadowing or crepitus. Making sure that we are aware if there's any cyanosis or pursed lip breathing. And then I also want to make sure to teach Bob that it's important to cough and deep breathe. You want to get those lungs expanding fully as much as possible, and if it is really painful, he could use a pillow to splint, and I could show him how to do that as well.